Okay, sorry. Who is judging the Shobhit Verma? Who's the discussant? Please keep in mind. So we are on to. Thank you very much, dear judges, for being so supportive at this early morning hour. And we shall go on to Dr. Shobhit Verma. The timer should be on for 4 minutes. Yes, thank you. On to you, Shobhit. All the best.
Limbal stem cell deficiency. So I want to thank my guide, Dr. Sayan Basu, and my co-guides for this being constant support during my project. So the aims and objectives of the study was to identify the HROCTA features that are most sensitive and specific for the diagnosis of LACD as confirmed by clinical examination, impression cytology, and confocal microscopy. It was a prospectively planned cross-sectional imaging study done in Cornea Service and Ophthalmic Pathology Laboratory, LVPI, Hyderabad, between August 1st, 2018 to 30th June 2019. Informed written consent were taken from all the patients and approval of ethics committee was taken. Total 32 eyes were included in the study, of which 12 eyes were diagnosed as LACD and 20 eyes were non-LACD, out of which 10 eyes were of vascularized or scarred cornea without LACD. So all the LACD suspects who were adult patients and has no clinically active ulceration or infection of ocular surface were included. Patient refusing imaging, uncooperative patients, poor imaging quality, and ambiguous and inconclusive test reports were excluded. So all tests were done at the time of presentation, masked observer analysis was done, and then the statistics was done. So this is a representative, one of the patient with LACD, where we have done the slit lamp photo, fluorescein test, past staining, impression cytology, cytokeratin 19 staining for immunohistochemistry, and confocal microscopy to prove the LACD case. So we did the ASOCT and did the measurement of reflectivity using the ImageJ software by selecting the corresponding epithelial and the corresponding stromal area. Then we did the angiography. So this is done in a quadrant wise, and this is a custom-made collage of the images where we can see it's a normal person. There are hairpin bent capillary loop pattern of vessels. While in a total LCD, we can see that there are loss of hairpin shaped loop pattern of loop vessels and increased vascular density. So Python-based algorithm was used for HROCT angiography analysis. And first of all, thresholding was done, followed by the determination of region of interest, where manual demarcation of inner limbus was done. So in cases where there was extensive conjunctivalization, infrared image was used for manually demarcating, and automatic selection of the ROI was done using the software. So this is a customized and fast slab, where this software is for the retina, where we customize the upper RP offset and the lower RP offset throughout the all of the cases. And this is the post-segmentation to check the superficial limbal vascular density. So vascular density analysis was done within the vascular pixels in the ROI divided by the all pixels. So there were a number of parameters we analyzed using regression analysis, and out of which 4 of the parameters we found to be of clinical significance. So the mean epithelial reflectivity has an area under ROC curve of 0.903 with a Uden index of 0.73. Mean stromal reflectivity had an area under ROC curve of 0.67, while Uden index of 0.28. Ratio of mean epithelial reflectivity to stromal reflectivity, however, had a ROC curve of 0.97 with a Uden index of 0.90. So we can see that this parameter came out to be the best event for the criteria for the LOCD diagnosis. Mean superficial vascular density had an area under curve of 0.91. However, the Uden index was 0.71. So what we concluded as that 4 parameters we found to be clinically significant. However, there were multiple limitations of an anterior segment OCT angiography. There is high image acquisition time, due to which there are a lot of motion artifacts. The imaging horizontal to vertical section is not a smooth transition and increases the scan time during significantly. There are no clock hour demarcation setting in software for accurate 360-degree scanning of limbus, and software is custom built for retina, so that is another limitation. Thank you.
Dr. Jeevan Tityal to take on the discussion. Very well presented.
Yeah, I think the entire presentation had the meaning which you wanted to express the things. The only thing is this going to be a clinically significant investigation to really assist the diagnosis we make clinically in all these stem cell deficiency areas? And you rightly pointed out the limitations also. If you look into your work, would this translate into cases where we do a serial analysis and see if the case are deteriorating with the time, or with your treatment, is there any change happening? How
Yes,
do you
sir.
apply that?
Yes.
Would you be able to analyze the same area every time?
Yes, sir. So there have been like another study been done on the same reflectivity parameters where patients have been done, SLET has been done on the patients, and the reflectivity analysis has been done post-SLET and pre-SLET. So they have this reflectivity criteria has been found to be that the epithelial to stromal reflectivity improves post-SLET. Although it never achieves what is the normal. In the normal cornea to stromal reflectivity, that parameter is never achieved in a post-SLET cases also. That has already been, the work is being done to apply that in the other.
Do you want to call?
No, the basic idea was, suppose we like to see the progression of disease or improvement of disease.
Yes.
So there should be some sort of a system by which, okay, this percentage, this much, we can say this is happening. Good.
Thank you.
Thank you, Dr. Shobhit.
Yes.
Can we give 20 out of 20 to those who stick to time, or is there?
Why not?
Yes,
Yes,
can we-
sure,
can we treat it
definitely.
as a
100%. Yes, we could.
blanket rule should be
Yes,
done
yes, yes.
instead of
Yes,
giving
only thing, some of them may not be there. See the name when you give the marks. Sorry. Doctor. Okay,
Yeah.
thank you very much.